We'll come to order. The AIDS epidemic is likely to continue to plague the nation well into the next decade and even into the next century. The number of people infected is staggering, and it will continue to escalate. The magnitude of this scourge, which has been called a possible catastrophe and a health disaster of pandemic proportion, may soon surpass any disease in this century and possibly any disease in history. AIDS is a crisis for industrial and developing countries alike. We know that 5 to 10 million people throughout the world are already infected, of whom 1 to 2 million live in the United States. Within 5 years, there may be between 50 to 100 million people worldwide infected with the virus. Approximately 5 to 10 million of them will be Americans. These unthinkable numbers and the equally alarming projections by the Public Health Service are convincing evidence that no sector of our society is safe from the crisis. Families, schools, businesses, recreational institutions, governments at every level are all being forced to confront the dilemmas, distress, and even the hysteria provoked by AIDS. From a local perspective, the number of cities and states with significant numbers of new cases has grown at unprecedented levels over the last year. There are now 14 U.S. cities with more than 300 active cases of AIDS. There are 27 states with more than 100 active cases. In 5 years, we'll have approximately 270,000 people with active cases in the United States. Unless a cure is found, every one of these Americans will die. These numbers should convince us that all-out action is necessary. We must do as much as we can to halt the spread of AIDS and find the means to prevent it and cure it. Over the past year, awareness and concern have increased dramatically in the Congress and throughout the country. A number of experts who are at the leading edge of the fight against AIDS are with us today as witnesses. During 1986, several eminent institutions joined the effort to provide the leadership required to control and ultimately conquer this disease. Our witnesses this morning include the Surgeon General, the co-chairs of the National Academy of Science Panel on AIDS, the AIDS Coordinator of the World Health Organization, and the National Institutes of Health, prominent representatives of industry and distinguished researchers. Most Americans were surprised to learn a few years ago that vaccine testing had already begun in the African country of Zaire. Some researchers have expressed concern about the nature of that vaccine and how it's being tested. In this country, testing may begin within a year on one or possible additional AIDS vaccines. Yet there are many questions which must be answered before a vaccine becomes safe, usable, and generally available. Other questions are equally pressing. Are we moving drugs that offer the potential of a cure into clinical trials quickly enough? Is our national research effort large enough and targeted for maximum effectiveness? In the meantime, those who are infected need compassion, support, and the hope of a cure. Those who are at risk of infection need counseling and education. And all of us need the commitment and the discipline to continue to give this crisis our highest priority and to provide resources and national leadership commensurate with that priority.